So, emerging infectious diseases, the infections that appear in a population for the very first time, or there are existing infections that have undergone significant changes. So these infections are often caused by a new or previously unrecognized pathogen or known agents that have spread to new geographical locations or new populations. Or they can also be caused by previously known agents whose role in specific disease cause had previously gone unrecognized. So these diseases have a potential to spread quickly within populations. Giving an example of the famous COVID-19, and then Ebola virus, Zika virus, there were new emerging diseases. And what are re-emerging infectious diseases? So these diseases are previously known infections that have a significant increase in incidence or geographical range after a known decline. So these infectious diseases were previously under control, but are now increasing in incidence or geographical range. So they often decline due to public health measures or interventions, or even changes in the pathogen population. They can also decline due to development of resistances to treatment or interventions. And these diseases spread to new areas or populations. They may include TB, measles, among others, as we are going to look at them. So what are the factors contributing to emergency and re-emergency of infectious diseases? So we're going to look at a variety of them in today's class. So we may look at the climate change that causes or alters the ecosystems and affects the distribution of vectors like mosquitoes, and this expands the range of diseases like malaria or dengue fever. When you look at globalization and travel, the increased movement of people and goods can facilitate the spread of these pathogens across different countries and borders, and generally different geographical locations. Looking at the changes in land use and agriculture, changes, for example, deforestation and encroachment on wildlife habitats can increase human this transmits. So diseases are able to jump from animals and cross over to humans. We have mutation and evolution, where pathogens can mutate and evolve, leading to new strains that can evade existing immunity or treatments. For example, influenza. Urbanization. Urbanization leads to high population density, and in most areas where there is a high population density, there are poor living conditions, and this can really facilitate the rapid spread of the infectious diseases. That's why basically in Uganda, coronavirus was so much common centers as compared to rural areas due to the congestion, population density in urban areas. Looking at antibiotic resistant animals contributes to the development of resistant strains that may lead to re-emergence of these infectious diseases. Looking at inadequate infection control, where poor infection control measures in the healthcare systems or in the healthcare settings can facilitate the spread of these infectious diseases. For example, hospital-acquired infections. When there are poor control measures within the hospitals to prevent infection of the non-patients, there will be reemergence of new cases of different infectious diseases. For example, if control measures are not taken against TB in the TB centers, where people visit the centers and are not putting on their masks, they're not washing their hands, the spread will increase, or TB will be able to emerge in different populations. So when we look at war and conflict, the displacement and breakdown of public health infrastructure during the wars can lead to outbreaks. Uh, an example of this is cholera. There has been reported cholera in many refuge camps. Overcrowded and unsanitary conditions in farms, livestock farms, can also promote emergency and spread of pathogens among animals, and these can potentially spill over to humans. The rising temperatures, the changing weather patterns can also alter the distribution and abundance of vectors. So, and many more other factors that you can think of, very many other factors that you can think of. Socioeconomic factors like the wealth index, poverty in particular, where the poor do not have access to good health facilities, so they're not able to treat the diseases, and so the diseases can keep in the population or grow, emerge, and re-emerge. So you can think of as many factors as possible that contribute to the emergence and re-emergence of these infectious diseases. Are we still together? Yes, Samuel. Yes, Mr. Samuel. I think the hand is up by mistake. Can continue. So let's look at some few historical examples and impact of these re-emergencies. So in the 14th century, the bubonic plague, commonly that was transmitted by fleas, we talked about it, was it in our second lecture, caused widespread devastation in Europe, wiping out approximately 30 to 60% of the population. And the Spanish flu in 1918 also wiped out an estimate of 50 million people worldwide. And it was a very contagious influenza pandemic. Then HIV also emerged in 1980s, It was a newly identified virus and caused devastating and chronic human immune deficiency syndrome. Very many people died during those times, and many others that you can think of. So let's look at some of the examples of the emerging infectious diseases. First, let's look at Zika virus, which was first identified in humans in 1952. But the large outbreak in the Americas was around 2015 to 2016. And this brought very significant attention due to its association with the
It has gone up.
Sorry, I was unmuted. I didn't know I was unmuted. I kept talking. So this Zika virus was primarily transmitted by the Aedes mosquito, but it can also spread through sexual contact, mother to child during pregnancy and childbirth, and even blood transfusion. And the symptoms include the rash on the skin, joint pains and muscle pains, headache, and in severe cases, one can have a fever. So Ebola virus is also another example of emerging diseases, and it was first identified in 1976 in the DRC. It was transmitted primarily through direct contact with bodily fluids of the infected individuals or animals, in particular bats, non-human primates. The symptoms included general body weakness, muscle pains, fever onsets, headaches, sore throat, and in severe cases, one would get internal bleeding and organ failure would also occur. This Ebola virus disease was highly fatal, with mortality rates ranging between 25% to 90%, depending on the strain and access to care. It was a very big challenge in the DRC, and it has continued re-emerging. Then it was identified in 1998 in Malaysia and Singapore, and its transmission was primarily through contact with infected pigs or their secretions, or by consuming contaminated food products. So the symptoms included still muscle pains, cough, vomiting, headache, and fevers. So the inflammation of the brain could also occur in severe cases. So Nipah virus really also had a very high mortality rate of up to 75% in some outbreaks. Let's move on to the severe acute respiratory and China, transmission was primarily through the respiratory droplets, aerosols generated by the infected individuals during a cough, sneezing, or even talking. Although in some cases it was reported to be found in the feces of the patients. The symptoms included fever, shortness of breath, loss of taste, fatigue, general body weakness, and it ranged from mild to severe. And still, some individuals did not show any symptoms. The ongoing impact of COVID-19 pandemic is still very evident. It caused a lot of death and a disruption in the social and economic sectors in different parts of the world. So let's look at still at the avian influenza H50, H59N1 and H7N9 strains of the avian influenza. These are very highly pathogenic viruses that primarily infect birds. However, they can also jump species and cause illnesses in humans. So, transmission from the infected birds to humans is usually the major form of transmission, either through direct contact or inhalation of respiratory droplets. And symptoms may include still cough, sore throat, muscle pains, difficulty in breathing, and fevers. And in severe cases, one may get pneumonia and respiratory failure. So let's go on and look at some cases of re-emerging infectious diseases. Are we still together?
Yes, we are following you.
Are we still together?
Yes, madam.
Yes, we are.
Are we still together? Okay. So tuberculosis is an example of the re-emerging infectious diseases. Its history has been described back in the centuries, where it is said to have declined in many developed countries due to the improved sanitation, living conditions, and widespread use of antibiotics. Re-emergence occurred in some parts of the world due to the emergence of a drug-resistant strain, and these strains came up due to incomplete treatments. Patients were not adhering to full antibiotic regimens, allowing the bacteria to develop resistance, thereby emerging these two strains. So also HIV AIDS that weakened the immune systems made individuals more susceptible to TB reactivation and new infections. So the major challenges of these reemergences of TB are the drug-resistant TB was really very complex and expensive to treat, and the treatment was really lengthy. And it requires strict adherence to medication to prevent further resistance that caused the development of the other resistant strains. So the World Health Organization has put in a lot of efforts to fight against TB with the End TB strategy. And this is aimed at reducing TB mortality, incidence, and prevention of further emergencies of drug-resistant strains. So let's look at malaria. Malaria has been known in history as a long-standing disease, particularly in tropical and subtropical regions. So re-emergency occurs due to increased resistance to antimalarial drugs like chloroquine and quinine. Environmental factors such as climate changes that may lead to increased mosquito bleeding and transmission, and socio-economic factors, mostly poverty, which leads to lack of access to health care and inadequate vector control. All these contribute to re-emergency of malaria. So the development of new antimalarial drugs is very important in combating resistance to malaria. And improved vector control measures like insecticide nets are also very important. And then there is also a global effort under WHO, the famous Global Malaria Program that aims to reduce malaria cases and deaths through prevention, control, and elimination strategies. And so many of these studies these days have been put up to study different malaria control measures, interventions. There is so many things, research is being done on how to combat and reduce the incidence of malaria and also increase the effectiveness of the interventions that have been put in place to control malaria. Dengue fever is also one of the re-emerging diseases, and it has been described for centuries, primarily in Southeast Asia. Re-emergence has occurred due to urbanization that creates ideal breeding grounds for the mosquitoes, the Aedes mosquitoes that are the primary vectors. Then the increased travel and globalization also facilitates the spread of the virus to new areas. The climatic change also may alter mosquito distributions and transmission patterns. The major challenge for dengue fever is that there is no specific treatment for this virus. So you really have to be very conscious about avoiding the mosquito bite. And all interventions to prevent dengue fever are mostly targeted on the vector control. There is ongoing effort to develop an effective vaccine for dengue fever. The WHO, under the Dengue Control and Prevention Guidelines, provides recommendations for surveillance, prevention, and management of dengue fever as a global effort to curb reemergence of dengue fever. Measles is also historically known as a highly contagious viral disease spread that was very widespread before vaccination. So reemergence of measles occurred due to non-compliance to the vaccination. There was misinformation, and most of the populations were not immunized. So outbreaks occur when unvaccinated individuals come into contact with the virus. And then measles keeps reoccurring in the areas. So let's look at cholera. So cholera has also been known as a bacterial infection, historically transmitted through contaminated water and food, causing severe diarrhea and dehydration. Re-emergency has been registered due to the floods and earthquakes that can disrupt water and sanitation systems, leading to outbreaks. Conflicts and displacements that can create crowded and unsanitary conditions also facilitate transmission of this cholera. Inadequate access to clean water and sanitation is also a risk for transmission of cholera. So, in prevention, oral cholera vaccines have also been developed to offer additional protection, but still, vaccination coverage needs improvement in high risk areas. The WHO's Global Task Force on Cholera Control Program also aims to, excuse me, the WHO's Global Task Force on Cholera Control also aims to control cholera outbreaks and prevent its spread through a multi-pronged approach. And that marks the end of our class today. Thank you very much for listening.